Hi guys, again my name is Val. I am a nursing student and this video is going to be about products and ways that I prepared for nursing school, things that I purchased book-wise, and like what stethoscope I used and why. Again, this video, it's not sponsored or anything. I'm not being paid to say this stuff. This is just my personal opinion. Again, I am a nursing student, so I'm also still kind of learning, and this advice is just my advice, what's worked for me, and what's worked for some of my classmates and my fellow colleagues as well. And I think the most important thing to remember when we're preparing for nursing school or we're in nursing school and we're being bombarded with all this advice and all this information is to just take the bits and pieces that you think are going to work for you, write down your resources, and have them there ready in case you ever do feel overwhelmed and you feel like you're not getting the information, and you have something to go back to and be like, oh wait, I had this resource from this one person that said that this might work. Let me check it out, and maybe that'll work for you, because not everybody learns the same, and not everybody gets the information the same way. So I'm gonna start by explaining first that my school here in Arizona does not do like physical textbooks. We go through Lippincott. And sorry, I think if you guys hear squeaking or like hear some weird noise in the background, that's my dog. He's on the floor. He never leaves me alone. Let's see. He's literally there squeaking his squeaker toys. He's 152 pounds and he has toys like that big. So I don't know. But sorry if that bothers you. You're going to see him moving back there. But yeah, my school does not do physical textbooks that you would purchase or you could buy used online. We do products through Lippincott online. You purchase this huge bundle in the beginning. It has like 6 or 7 books. I wouldn't say 6 or 7. It has like DocuCare and the fundamentals books and like nursing skill books, pharmacology, different ones, and it has different programs too. It has like Picmonics, so you can do VSEMs. It has interactive tools. It has the advisor too. It has like a Lippincott advisor, which is the drug guide, and it has a bunch of other stuff. You can do, they have like some nursing diagnosis things on there. They have like patho stuff. It's a pretty helpful resource, and you can purchase. I know that if you go onto the site, you can order from them for like $50 the book that you want, and they print it out for you in black and white and send it to you for you to put in like a 3-hole punch binder. I'm not really a big fan of that. I wasn't a big fan of the online book either, but honestly in nursing, I really don't like sit here all day and read the textbook. I am a textbook person, but I can't say that I sit there and read the textbook. I really do like to skim through the chapters, so I've been a little bit more like tech savvy as far as that goes. But there are physical things that I purchased that were not on the required list, but kind of on the recommended list for my program, and obviously every program is different, but I think that this in nursing would help anybody. So the first one that I'm going to show you is the Davis Drug Guide. This drug guide is something that I know a lot of people in the medical field, around the states utilize this. This is a really good book. I have the 16th edition. I know my classmates, some of them have the 14th edition, the 12th edition, those like other editions, and it works out just fine for them. So this is kind of a supplemental, and the way this breaks it down, I feel that it was a little bit easier for me, and for me having something concrete was a little bit better than going through the Lippincott advisor, especially because I don't have like a setup where I have a bunch of monitors up on my screen and I can put, the drug advisor on one screen and my care plan on another, or things like that. Like, it's kind of hard to manage all those things on one computer screen, even with the split screen function. So I really like having this here, because I can even like dictate and read through it, and the way it breaks it up is really good. It has like important information, important assessments that you need to make as a nurse that you just cannot miss. In red, it has all of the names of the drugs in the back on the index, including it has the generic name and the brand name. And if you see, I did all these in school. I mean, in block 1 they gave us like 30 meds that we need to know, so I did like tag them all. And then what's cool about this is that I know some nurses that are, not in nursing school, they're actual nurses, and they utilize this Davis drug guide. When you purchase it, you get a free 1-year subscription to it, and you can even view this stuff online. You can have it on the mobile app. I don't know if it's an app or just like a mobile version of it, and I know people all over that use this, so this was a pretty good buy. And compared to kind of what I already spent in nursing school, this really wasn't that expensive. I don't know if it was like $50, maybe less. I'm not sure. Don't quote me on that. I bought it through my campus bookstore. So this one was very, very helpful. Some people that have been going through the online Lippincott Advisor have ended up purchasing this one, and some people haven't. They're fine with the Lippincott, so I think it just depends on you. But if you're someone that likes concrete, this is nice. It's small. I throw it in my car. I throw it in my bag. It goes with me everywhere. And I don't have to like open up my computer or try to log into my website to try to find a drug. I can just get it off the book. So that one was a good one for me. This is also, as I said, like Lippincott has mostly everything. This was on the recommended, but not, it was like optional, but not like you have to buy it. This nursing diagnosis handbook from Elsevier. Some programs utilize Elsevier. I know in Arizona there's a school that uses Elsevier instead of Lippincott. This nursing diagnosis handbook, this is the 11th edition. I looked at the 12th edition. It was pretty nice too, but I like the way this one is broken up. Again, it's easier for me when I have this and I have my care plan on my computer screen. I can still have this off to the side to use it. It's great because your diagnoses are all in here, any possible ones. And then they also have, what I really like about this is if you look at it at the bottom, it gives you all the information on the possible nursing diagnosis. It gives you the definition of what it means, any defining characteristics, related factors. So when you do your diagnosis, you can do like, your diagnosis related to this as evidenced by this, or if it's a risk factor related to this, whatever it is. And I know some of you that are probably not in nursing school yet, you're like, what is she talking about? Don't worry, you'll know. And it breaks it up really nicely for someone that's like a beginner that didn't really understand. Like, it was so hard for me to wrap my head around the fact that I can give a diagnosis. Obviously, it's not a medical diagnosis, it's a nursing one. But to me, I was like, what? Nurses do that? So this has outcomes, suggested interventions, nursing interventions and rationales. And the cool thing is at the bottom, it really splits it up for you, and it tells you like client outcomes. The client will verbalize whatever, and then it tells you like, don't forget to specify your time frame. And then it breaks it up nicely because it has independent interventions with their rationales, because you need proof for everything, right? And then the independent ones are the ones the nurse can do. and it has collaborative as well, which is what the nurse can do with the doctor, right? So if it's like, oh, monitor oxygen intake or put the client on oxygen, that's not something that the nurse can do on their own. That's something that the nurse needs with the doctor. But it has that on there, so you're really able to look at that. And then it has the rationales are split up as to evidence-based nursing, just general evidence-based practice, and classic research. So classic research is just stuff that, was things that it's just been done that way. They've researched it, but it's not quite an evidence-based practice. It's just research found versus evidence-based practice. And it's nice because when you're starting off, my instructor she makes us do rationales, and everything has to be evidence-based practice, right? We can't just treat a client just because a certain way, just because. We need to have a reason, and it needs to be based on science. It needs to make sense. So this really splits it up for you. So this one was a really, really good one, and it has all the nice NANDAs and information all split up perfectly. And it even splits up your interventions based on just general pre-operative interventions. They have surgical interventions for surgical client, post-operative interventions, and it has geriatric and pediatric interventions. So this would help you all through the program. And then I have this other one. This was given to me. This is also via Elsevier. And this was given to me, and I don't know if maybe because I have the other one that I prefer the other one. But this is really nice because I was writing a care plan, and in my nursing school we have to do our care plans from scratch. So we don't just get to like click buttons around in the DocuCare or anything like that. I mean, we have some like those, but we have the main care plans. And the other one, real quick, this is Elsevier Nursing Diagnosis by Ackley. So Ackley. And this is also Elsevier. And this is nice because the rationales, there's more rationales. Like I can find the same NANDA, but there will be different rationales, and it's kind of split up a little bit different. And it's split up as therapeutic interventions, educational and continuity of care interventions, and ongoing assessments. So it is split up differently, and it is really nice because I'm not gonna lie, when I was doing my first care plan, I utilized both. And there's a ton of NANDAs. Like if that other book had all the NANDAs in the world, that book would not, that book is not big enough, So this has more stuff on it that I was able to utilize both and utilize my resources. And I looked at the other one more in the beginning, and I didn't look at this one until like 2 or 3 months into nursing school, that I was like, I need more. I'm not sure, how to like find a good NANDA out of this one. And so I looked it up through this book, and this one was really, really helpful as well. Like I said, I don't know if I would purchase it, because a friend of mine purchased this in class because someone else from another program had recommended it to her, and she really, really liked it. And it just so happened that week, someone that I know that she finished nursing school, she gave me this, and I was like, oh, it's the same one, and it has been really helpful. So I don't know, if you're someone that likes to have multiple resources, I would get both. So, and in Lippincott, I need to reach over. In Lippincott, they have NCLEX style stuff through their program called Prep U. So I haven't really been thinking much about the NCLEX. I'm like, oh, I'll worry about that, when I'm in block 4 or whatever. But with this additional class that I'm taking, it's like an NCLEX class, and we have to have like a certain couple of thousand of questions answered by the end of the semester. So this is a good Q&A book that I have. And again, this one was given to me, and I'm sure there are going to be others out there, because as you progress and you get into the program, maybe the NCLEX changed, so you might need something different. So this one's only as relevant as the NCLEX lets it be. And this is a physical Lippincott Q&A review for NCLEX RN. This is the 11th edition by Diane Billings. This was, like I said, given to me. This is the same style as the online stuff. It's called Prep U. This is powered by Prep U, and this is kind of like if you're one of those people that like to have stuff on paper, this is helpful. You can throw it in your car, and if you're out somewhere like with your kids waiting for them to finish practice or something like that, I take this with me, and it's kind of fun. I know I say fun, you guys are probably like, what? No, it's kind of nice to have it, because I can just kind of open this up. Sometimes I'm at my mom's house, and then it's like downtime, and my family is all talking, and my husband are just talking to my parents, and I'm not really doing anything, so I kind of bust this out and look at it. It's really helpful to have this. But again, it's not really a requirement. That one was given to me, so I would see if anyone's trying to get rid of their stuff, you know, because once you pass the NCLEX, what do you need that for? And then I have two more things. I didn't want this to be a super long video, but I think it might end up being, I might split it up. I have this might be a two-part video, because I have stuff that I bought that's kind of like not really a necessity, but it's nice to have. So I'll do a second part of like the extra stuff that's not necessarily, that I find not a necessity, right? Because this is technically not really a necessity if your school doesn't require it, but to me it's a necessity because I use these all the time. I use these things weekly. So, and I only go to school on Fridays, and then I have clinicals on some other days depending, and this is I use it all the time. I guess I don't really need it because I could make do with the online package that I got, but I use these all the time. And so this is a necessity one here. I purchased my Littman Classic 3. And I got the Littman Classic 3 stethoscope. This is what it looks like in the box. Let me open. It comes like this. So it has the extra earpieces and the extra part for the bell and a little instruction booklet. This is actually my extra one, but this is the box, and that's how it comes in the box. I purchased this one. Sorry, my pen light was on. I purchased that one because I had emailed the instructor asking her which one she recommends, because there's so many stethoscopes online, and she said that this is probably the best one, because the cardiology one, the Littman cardiology one, they look really cool, kind of like a classic one. They're thicker than this. They have like a bigger area, and she said that this is better for nurses, especially ones that are starting off, because you can utilize, it flips, and you utilize the diaphragm and the bell. And she said the cardiology one is kind of harder for newer students, because when you're really listening for those S3, S4 sounds of the heart, or you're really trying to listen into those quiet sounds, the cardiology one is based off the pressure that you apply for the patient, like onto the patient with this, and it's not based off of just flipping it, if that makes sense. But I'm sure whatever one that you can get works. My program recommended the single tubing, not the double tubing, because it is a lot harder to hear, and you really do want to hear the right sounds. And then just so you guys know, a little disclaimer, you see how it does this? this part, it needs to face away from you. So like my face goes in here, because then it fits perfectly into your ears. And then kind of something I learned from someone that's been a nurse for 14 years, my clinical instructor, that if you put this in and you're really trying to listen and you can't quite hear, if you pick it up like this and kind of pull, it settles into your ears better and you can hear, especially when you're checking off for like blood pressure and they have the dual stethoscope and you can't hear as well, and you have an instructor listening for the same sound as you. You do want to kind of do this, because this will allow you to hear the sound so much better. So I purchased that. Something that was required in our program were scissors. I got the 5.5. Oh, and I got that Littman thing on the stethoscope on Amazon. They have them on sale all the time. I think I got it for like $70. This I also purchased on Amazon. I take them out for clinicals. I utilize them a lot actually in clinicals. And I kind of like the other ones. Obviously your program might require something different. They might require these. I thought these were the ones that were required, but honestly they didn't really care what we had as long as we had medical scissors. And I kind of like those other EMT looking ones, but the 5.5 inch is what I got. And then I got the, I think it's Lister bandage scissors, and I got that on Amazon. So 5.5, and that was purchased. This was like, I don't know, $7 maybe. I'm not sure. I don't remember. And then pen light. So I have pen lights. This one my university cohort gave to me. This one I purchased. So this is like, it's nice, and this one's really, really bright compared to this other one that I have that's not as bright. Obviously, can you tell the difference? These are really different. You definitely want a nice bright one because you really want to be able to see when you're shining it in your patient's eyes. And because the lights are on, and if you like forget to turn the lights off, or you really want to see something, or you're doing a skin assessment or assessing like mucosal membranes, you want something bright enough. The only thing is that I don't know what brand this is. I got this on Amazon and it came in a pack of 2, and I think it was like $8, but there are cheaper ones that come in like the multi-pack. Get the multi-pack, keep them, keep extra batteries with you, because when you utilize this thing, sometimes I leave it in here and it just magically turns on and stays on. And sometimes, if you guys saw me, I was trying to like mess with the little cap to get it to turn on, because they are kind of weird. And then another thing I would definitely have is I would just go to the store and buy an extra pack of alcohol pads, because when you go to clinicals, and sometimes the nurses, you know, at clinicals don't want you to get their stuff from their cart, and they don't just have these freely in every facility, you know what I mean? So you definitely want to have some in your pocket, and you can use them to clean off your stethoscope between patients. And then I would say that is it for like kind of the required-ish stuff that I would definitely recommend. And then I'm going to do another video part right now of stuff that I purchased to like carry my things in. I have like a clipboard thing that I recommend too, and a few other stuff that I got that really helped me, and it still helps me in nursing school. So yeah, if you guys want any other info, maybe you need help with writing a care plan, or how to read this, you know, diagnoses book, or how to utilize this other drug guide, or anything like that, sound off in the comments below, and I will do my best to help you guys. Thanks for watching.